Is it working? There we go. Hi, everyone. My name is Brandy Thomas, and I am the producer for Texas Fertility Center. Thank you so much for joining us for today's webinar on IVF basics. I'm going to be bringing on Dr. Munch from Texas Fertility Center San Antonio here in just a second. But before I do, I just wanted to go over a few things about the webinar and about our webinars as a whole. So first off, this is part of an ongoing series that we're doing for Texas Fertility Center San Antonio. We're going to be having webinars every other week. The next one that we have coming up is going to be covering your first fertility appointment. So if you're new to IVF and you haven't started the process yet and you're wondering what kind of things happen at the first appointment, that webinar would be a great one to register for. All you need to do is go to fertilitysanantonio.com, and then on the navigation, there's a button that says webinars. You just click on that and you'll be able to register for it directly on there. Another thing I wanted to add is that after Dr. Munch finishes talking about everything she's going to be covering with IVF, there will be a portion at the end for questions. So if you look at the bottom right of your screen, or it might already be pulled up on the right-hand side, there's a questions panel. So if you have any questions throughout the webinar at all, you don't have to wait until the end. You can submit them while Dr. Munch is still talking. Just go ahead and put them in there. Just know that they are completely anonymous. No one will know your name or what your question is or anything, so you don't have to worry about that. And I think that about covers it. So I will go ahead and bring on Dr. Erica Munch.
Thank you, Brandy. Hey guys, it's Dr. Erica Munch with Texas Fertility Center. Thanks for joining me on today, the first day of spring, so that way we can kind of talk about IVF and go over the nuts and bolts. As you know, IVF is something that a lot of people are talking about now, more so than probably even in the past 10 to 20 years. Certainly you've heard about it in the news, so it's a great thing for us to review about what IVF is and how it can help our fertility patients. So just to start kind of talking about what IVF is in general, it's called in vitro fertilization. That's what IVF stands for. It's basically the tool that we use to help patients achieve a pregnancy, sometimes when simpler things haven't worked, and sometimes because we need to because of other factors that come up in the evaluation. IVF, or in vitro fertilization, means that the egg and the sperm are actually meeting outside the body, as opposed to when we think about more natural conception, where the egg is meeting up with a sperm that's swum up to get to the egg in the fallopian tube. The process of fertilizing an egg is still up to the egg and sperm. So IVF, while it kind of sounds, space age and rocket science-ish, is really just an opportunity for eggs and sperm to meet outside the body. All right. So the purpose of IVF is to allow the egg and sperm to meet outside the body so that an embryo can be placed back into the uterus at the right time. You can think about the fact that IVF would be used for patients that have blocked tubes, right? And that actually is one of the primary reasons that we use IVF, is for patients that have blocked fallopian tubes. Because if their tubes are blocked, that means the sperm does not have a way of swimming up into to meet the egg. And for those patients, IVF is going to be the necessary way for them to achieve a pregnancy, or for patients maybe who have had their tubes blocked on purpose, right? For women that have had their tubes tied and might be at a different stage of life or with a different partner, and they're deciding to get pregnant. Similarly, even if we have the egg in the tube, but we don't have enough sperm to get up to that egg, that's another reason why patients might use IVF. So for guys that have very low sperm counts, or motility is not moving and swimming quite as it should, or for guys who have had a vasectomy, where even if the sperm has been cryopreserved or taken out from the area behind the testicle, that sperm is still used for an IVF procedure, because then we know for sure that we've got enough sperm and egg combinations and we can cover all of our bases. The other reason that people use IVF is when they have tried potentially lesser invasive things that we'll talk about in other seminars, like inseminations or intercourse cycles, but they haven't been effective, and we're trying to get to the root cause of their infertility. And then we do IVF to increase the chances of finding the right egg and sperm combination, because IVF is actually the safest way of being able to do that. We can try lots of sperm and egg combinations and still almost always end up with a singleton pregnancy, which of course is not only healthiest for the mom, but absolutely healthiest for the baby. So those are kind of the reasons why you might hear about people doing IVF, because it is one of the most effective tools we have, as well as one of the safest tools we have. So how does IVF work, right? IVF is a process, right? A lot of times patients will ask, well, how long is this going to take? And even though that total amount of time, which might be, 6 to 8 kind of overall weeks of how long IVF takes, you're not here all the time for appointments with IVF, but it's definitely a process. There's a process of getting you ready for IVF. There's the process of actually getting the eggs and sperm out, right? And then there's the process of putting the embryo in. So the process of IVF starts with getting you ready. We'll talk a little bit later about lifestyle factors or other things we need to do. But generally, before we start an IVF cycle, we want to make sure that the ovaries are nice and quiet, that there's no cysts or anything that prevents us from being able to try to maximize the number of eggs that we get all at once. In humans, we usually have a couple eggs that are willing to grow, and in a natural cycle, only one continues to make it to the finish line. But the goal in an IVF cycle is to have more than one make it to the finish line, because we're going to be doing a procedure to drain the ovary to get as many eggs as we can. So in the process leading up to the actual stimulation, we sometimes use birth control pills or we sometimes use estrogen tablets to keep that ovary in a holding pattern until it's ready to start the stimulation. In humans, it takes about 10 to 14 days to make eggs. And that's true whether or not we're using our own natural cycle or we're doing an IVF cycle. But during that 10 to 14 days of an IVF cycle, because we're using medicines to stimulate the ovary to allow many eggs to develop, we do ultrasounds. So among your friends or colleagues that have gone through IVF, you've probably heard that they go in for ultrasounds usually about 2 or 3 times a week over the course of those 2 weeks, so that their doctor can be monitoring by ultrasound and by blood work how their ovary is responding to those medicines, changing the doses of medicines as needed, adding in other medicines that are used to prevent ovulation from happening too soon, and getting things ready to the moment where we think that those follicles, those fluid-filled spaces, are big enough where we think they're likely to contain mature eggs. And that's when the egg retrieval happens, all right? The egg retrieval is the process by which we take the eggs out of the ovary, right? Sperm can be pretty easily acquired outside the body, but with eggs, we have to work harder to go get them. So a procedure is done called an egg retrieval, and that's done while you're asleep using a kind of a light anesthesia like a colonoscopy, where the anesthesiologist keeps you comfortable, and we as the fertility specialists use a small needle attached to that same ultrasound that we've been doing, every time in the office, except we use that needle to drain the fluid from the ovary, and inside that fluid, the embryologists look under the microscope, and that's when they find the eggs. All right. So before somebody leaves the procedure suite that day, we know how many eggs their ovary made during that process. And for all the other things that go on in the fertility world, this is one of the few times that we really do feel like we've got concrete information about kind of what your body is doing. And I think a lot of patients really appreciate that. So we get the eggs. The male partner, as part of the cycle, is providing a sperm sample to be used in IVF. If a woman is single or in a same-sex relationship, we're using donor sperm that's going to be thawed and prepared that day of the IVF retrieval, all right? And then those eggs and sperm, like I said, they meet outside the body, right? It's still up to the eggs and sperm to do what they're going to do, but now we're able to compensate for some of those factors where we might have had low sperm counts or motility, but now we're really in a much better pace where we can choose the better quality sperm to be the ones that are covering those bases, right? So after an egg retrieval, a patient goes home and recuperates, watches movies on the couch for the rest of that day. And then the next day, the embryologists are going to take a look at under the microscope to see which of those eggs and sperm have successfully fertilized. Now, IVF is kind of like a funnel, okay? We start out with a lot of follicles and hopefully we end up with some number of eggs. And then we know that in humans, not every egg becomes fertilized. Not every fertilized egg continues to grow and divide, and not every fertilized egg that's continued to grow and divide can make a successful pregnancy. So the bigger that funnel is at the beginning, the more likely we are to make it to the point where we've got an embryo to transfer. So the process of IVF and doing the stimulation, getting the eggs, getting the sperm, having embryos, those embryos eventually get transferred back into the uterus. Sometimes that happens right away, a few days after the egg retrieval is done. More commonly nowadays, though, we choose to cryopreserve those embryos to use them in a much more natural cycle where your hormone levels are not crazy elevated. So in the embryo transfer part of the cycle, we have to prepare the uterus and make sure that it's in a right place for pregnancy by giving it the estrogen it needs to help build up the lining, and then to provide it progesterone for a certain amount of days. So that way we know that by the time the embryo is going in, the uterus has kind of been more or less convinced that it's time for a pregnancy. Almost always nowadays, one embryo goes in at a time because, like I said, that's the safest for mom and baby. And what happens is that when we do an embryo transfer, it's kind of like an insemination. We place a speculum on the inside of the vaginal vault, just like pap smear, and then we take a little tube and slip it up through the cervix, and we do that under ultrasound guidance because we want to make sure that we're being pretty precise about where that embryo goes. All right, and then a long 9 days later, 10 days later, we do a blood pregnancy test because we want to see if there's any evidence of an implantation. Right, it takes a couple of days for that embryo to start making enough signal that we can detect it in the bloodstream, but that's exactly what we're checking for when we do that blood pregnancy test. So again, the process of IVF is getting ready for IVF, the stimulation, and then doing the embryo transfer where we can place that embryo back inside the uterus. And especially for patients that have blocked tubes, that's the only way that the embryo is going to get into the uterus, since it's kind of like we're putting it in the back door. Okay. Now, the third part about IVF that I wanted to talk about today before I open it up for questions is talking about genetic testing, right? Because you may have read online or heard from your friends about genetic testing that can be done as part of an IVF process. You may want to know kind of more about what that's called, right? So the technical term for it is pre-implantation genetic testing, or PGT, right? It's big name shortened into an acronym for genetic testing that can be done on the embryo before it goes inside the uterus. Pre-implantation genetic testing, PGT. Most commonly, PGT is now done for testing the embryo to make sure it has the correct number of chromosomes, right? Doing testing, doing PGT, does not change the ability of the embryo to implant or not, right? Because it's going to work, it's going to work. But for some patients, it's beneficial to know whether or not that embryo has 46 chromosomes before we go through the efforts of an embryo transfer. It can help identify embryos up front that are more likely to make a pregnancy and less likely to result in not getting pregnancy or to have a miscarriage. But it can also help with patients with their overall family building goals, kind of knowing upfront what they have available to transfer, not only now, but for other potential pregnancies down the road. Some people do IVF because they want to bank up embryos now that they can use for other pregnancies, especially as they get older. And they would rather know now if they need to keep banking embryos for other pregnancies rather than to do a transfer, get pregnant, but then realize the other embryos were not successful in the future and they would have a chance to build those up now. That's called PGTA for aneuploidy. That's when we're checking for abnormal numbers of chromosomes, all right? Some other less common reasons that people do genetic testing on those embryos is because they want to know if that embryo carries abnormal copies of genes that both the parents have that can lead to things like cystic fibrosis, spinal muscular atrophy, Tay-Sachs disease, other things where they know that they've got a pretty high chance of having a baby affected by those conditions, and they go through IVF specifically because they're trying to reduce the risk of, even things like sickle cell disease and stuff like that. To do genetic testing on an embryo, it does involve a small biopsy or a sampling of cells that are going to try to become the placenta, not the baby cells, right? That's very important. But PGT is a safe and effective tool that can be used to help with patients to improve their pregnancy rates and potentially decrease their miscarriage rates. It's not for everybody, but it's definitely a good tool to know about and to ask your fertility specialist about if you're thinking about IVF. So with that, I'd like to take any questions that might be present. I know that one question that I see as far as like lifestyle factors, are there any lifestyle changes that I need to make before moving forward with IVF, right? And that's a great question because like most things, we always want to make sure we're in kind of the best place possible, right? I tell my patients to be the best version of themselves, right? And, that is, we're all human, right? So that doesn't mean you have to be a robot or completely cut out X, Y, or Z and just, completely focus your life on this, because there's a lot of other wonderful things that make people people. And it's not just about the sum of their eggs and sperm, right? With that being said, making sure that you're eating well, making sure you're taking a multivitamin if you're not getting the fruits and vegetables that you need as part of your diet. For some women, they may consider certain supplements that their fertility specialist may advise them that may help with egg quality, either because they have PCOS or because they have more diminished ovarian reserve. As far as, kind of obviously avoiding smoking, not drinking excessively, not starting drugs, those are all important things. Caffeine is okay, right? Caffeine doesn't change your ability to get pregnant. We do want you to have a more modest intake of caffeine when you are pregnant, but you don't have to completely abstain from caffeine during the process. And exercise is fine, right? Some people worry that exercise is going to affect their egg quality or development. And certainly as your ovaries get bigger in the IVF process, because they're more full of eggs, that you're going to be a little bit more sore when you exercise, but kind of listening to your body and doing what it tells you to do or not do in that case. And then really the biggest thing that I often find in talking with patients is making sure their weight is in a good place, right? The IVF procedure itself is somewhat invasive. You're asleep for it, but there is a pretty long needle. And so for patients that carry extra weight, that can be more risky when it comes to the needle going in places that you don't want it to go. And the more weight you carry, the more risk there is to that, as well as making sure that the anesthesiologist can get you comfortable and asleep. So generally speaking, a lower BMI improves not only egg quality, but it also helps with the safety of the procedure. Right? The other thing that sometimes we get asked about are like the side effects, right? Thinking about what do you feel when you're going through an IVF cycle? Am I going to be crazy? Am I going to cry at everything? Right? The choice to go through IVF can be a little bit, apprehension provoking and exciting at the same time. Most patients really do very well during the IVF cycle. I think there's something to be said for being empowered and saying that, you're really going to get a lot of good information going through IVF as far as knowing what your body is doing by making eggs, knowing how many of them are fertilizing, potentially knowing genetic information that you haven't been able to get through other types of cycles before. Patients that do IVF because they want to freeze their eggs for later use, I find that those patients really are feeling very good about, going through the stimulation. From a physical side effects standpoint, most people feel fine. Like I said, sometimes they feel more bloated. They just feel like something's happening down there. But as far as, the Clomid crazies, right? Most people don't really have that as part of this process because we're using a different kind of medication to stimulate your ovaries. And so really most people's mood levels from a physical, hormone standpoint are good. Now, don't get me wrong, there's a lot of emotional things that are riding on IVF, and there's a lot of reasons to feel all the feels, but most patients do very well with IVF. So one more question as far as kind of like genetic testing and whether or not that's something that right away, right? We usually have to wait for usually a week or two after the genetic testing has been done or biopsy has been done before we actually get those results back, which is another reason why usually the embryo transfer cycle follows the actual egg retrieval by a couple of weeks, because patients are waiting for that genetic testing result material to be back by then. Okay. I think that's all the time I have for today. So I appreciate you guys' attendance and joining us at TFC San Antonio for this webinar on IVF 101. Brandy, is there anything that you wanted to add?
Sorry about that. Thank you so much, Dr. Munch. Just a reminder again that we are having our next webinar. It's going to be on April 4th. We're actually doing that one in the evening. It's going to be at 7 p.m. Central Standard Time. Again, just go to fertilitysanantonio.com, click the webinars tab in the navigation, and you'll see it there, and you can register for it directly online. So thank you guys so much for joining us, and we will see you next time.
All right, take care.